Hello, friends. Welcome to Sustainable Work. I have a wonderful speaker here with me today. His name is Dr. Clark Gaither. Dr. Clark Gaither is a family physician, is currently the medical director of the North Carolina Professionals Health Program and a fellow of the American Academy of Family Physicians. He's an accomplished author, blogger, speaker, corporate consultant, and a personal life coach. Also known as Dr. Burnout, he's an expert in the identification, mitigation, and prevention of professional job-related burnout. He's the author of REIGNITE, a best-selling book about professional job-related burnout. A recipient of many rewards, Dr. Gaither was named Family Physician of the Year in 2002 by the North Carolina Academy of Family Physicians, and more recently was honored by the governor and the state of the North Carolina with the Order of the Long-Leaf Pine for meritorious service to the state of North Carolina and the citizens of Wayne County. Welcome, Dr. Gaither. It's so good to have you here.
Thank you very much. It's wonderful to be here.
Yeah, why don't you tell us a little bit about the work that you currently do, something about yourself?
Well, I was a family physician in the eastern part of North Carolina for 23 years, and I actually got burned out a second time, which was one of the reasons I became an expert in professional job-related burnout. But in 2016, I left private practice and became medical director at the North Carolina Professionals Health Program. Basically, we assist troubled providers, doctors, MDs, DOs, PAs, pharmacists, farm techs, veterinarians, and vet techs. We service all those folks who've gotten in trouble with drugs or alcohol or other bad behaviors, and they run into trouble in their life because of that. And so we try to get them the help that they need, get them rehabilitated, and get them back to work.
That's amazing. That's really wonderful work you do. So how did you get to be called Dr. Burnout?
Well, in 2009, I went to my practice partner and I said, well, if something doesn't change, I'm going to have to leave the practice of medicine. And I didn't understand it. I was frustrated by it. I couldn't understand how something I once loved and enjoyed very much had become really a source of dissatisfaction and distaste. I hated to go to work. I was hating not the people I served. I enjoyed the practice of medicine. It was the business aspect of medicine that was affecting me. And he said, well, do whatever you need to do, just don't leave. We had a pretty busy practice, and quite frankly, I wasn't ready to give up on medicine. So I made some changes that I thought would help. I reduced my hours. I went to 3 days a week. That meant a cut in pay, but at that point, I really didn't care. I would have paid somebody to make me feel better, so I paid myself by taking some time out of the office. I reduced my call. I started getting more rest. I started reading outside of medicine. I picked up some old hobbies and activities that I'd let go by the wayside. Started running more. In general, just taking care of myself. And within weeks, I felt better. I felt renewed, rejuvenated. I started looking forward to going back in, to the office. And so it was only sometime after that I discovered, and doing some searching around, that I was suffering from job-related burnout.
Yeah.
And so I began reading everything I could find on the subject and trying to figure out how to make myself better. And along the way, I started doing some talks, and they were well received. And I started doing some seminars on professional job-related burnout. And next thing you know, I've written a book about it. So at least I'm a self-proclaimed expert on professional job-related burnout. But it's because I've lived it. And everything was great for about 6 years, and then our PA left, our physician's assistant, and I started working. I thought, well, that leaves my partner by himself on Mondays and Fridays, so that's not good. I'll start working half a day Monday, and then I ended up adding a half a day Friday, and then I was working till mid-afternoon on Monday, and before you know it, I was back to full time. And within a year, or less than a year, really, it all came flooding back. I got burned out all over again. And that's when I knew it was time for me to leave clinical medicine and set off in a different direction.
Okay. And so tell me more, a little bit more about that. So what is that new direction?
Well, it led me to, fortuitously, the North Carolina Professional Health Program became short a medical director. And I started part-time with the intention of just working part-time. And after 6 months, I was having so much fun that the CEO made me an offer I couldn't refuse. I couldn't think of any reason to say no, because I was finally in an area that was pulling on lots of different threads from my past. And I felt very vital in that role. I was enjoying the work. I didn't feel overwhelmed like I did in clinical medicine. I didn't have any of the business aspects to attend to. And a lot of what we see that come through our doors is either directly or indirectly related to professional job related burnout. So it was just a perfect right place, right time, right job. And I've been there since 2016. It'll be 5 years in July, actually.
Wow. Well, congratulations on that anniversary. So what would you say is the difference between your work in clinical medicine and then later when once you started working with job-related burnout? Was it the time commitment, the type of work, the type of tasks that you were doing that was different?
Yeah, the pace is definitely slower. I started my career, in fact, my partner and I, we went through med school together, residency together, and we started practice together. And he and I, fit very well in terms of practice. And we started out seeing 15 to 17 people a day. And I thought, wow, this is as busy as I want to be. And then over the years, as reimbursements dropped and demand went up, I ended up seeing somewhere more than 30 patients a day, sometimes 35 patients a day. And I felt like I was on a hamster wheel.
Yeah.
I didn't feel like I was down to 6 to 8 minutes per encounter. And that's just not enough time to give people to address all their concerns. And so I felt like I was shortchanging them. And yet I was still billing under a provider number and collecting a fee. And so after a while, I felt like I was part of the problem. And that was another reason I left medicine. So the clinical medicine. So the pace is definitely slower. I feel I have more time to be thoughtful. I have more time to spend with our clients. Again, the business aspects, which is a big stressor, is not present in this role that I'm currently serving in. I don't work as many hours. I work a regular work week. And so the 55 to 65 hour weeks are gone now. And we go through different seasons in our life. And for this season of my life, this is the pace that I need to be at.
Yeah. Well, that's so amazing that you're so connected to yourself and you can feel that. So currently as a consultant and a life coach, what kind of work do you do with your clients?
Well, the people that we see have kind of fallen down in a way, in some ways. They've picked up a chemical dependence, either opioids, benzos, stimulants, and cocaine, street drugs. I mean, you name it, marijuana, or alcohol. Alcohol is probably one of the most common that we see, alcoholism. And it's negatively impacting their life. And so what we try to do is when someone, if they self-refer or if they're referred in by their board, their licensing board, or a colleague or their attorney or their spouse or whoever refers them in, we sit down with them for at least 2 hours initially, two and a half hours, and try to get a big picture of what has happened so that we can lay out a roadmap for them back to return to work and recovery. So I still draw on those threads from my medical training and background. And also I've been burned out. A lot of them are burned out, or burnout was the trigger that kind of pushed them over the edge. And so it's been a good fit. It's been a good fit for me.
Yeah. Okay. Well, I'm glad that you're mentioning that burnout is the trigger. So So how do you help people understand what exactly caused their burnout and make changes to address those aspects so they don't get burned out again? So they
Well,
can.
let me first make the distinction between the hallmarks of burnout and the underlying causes, because a lot of the attention is focused on the symptoms rather than the cure.
Right.
The hallmarks of burnout, there are three. There are three, and this was worked out by a PhD psychologist by the name of Christina Maslach back in the 1980s, early 80s, and she developed the Maslach Burnout Inventory, or MBI, and it's a short questionnaire that determines if people are suffering from burnout or not, and to what degree.
Mhm.
And it addresses these three domains. One is emotional exhaustion, and that's a common theme when people are burned out. They feel like they have nothing left to give, like they've left it all out there, that they're just emotionally spent and they can't meet any more emotional demands that are placed on them. The second hallmark, and I call them hallmarks because it's not a medical diagnosis, it's an occupational problem. And so they're, instead of symptoms, which you would associate with disease, these are hallmarks which are associated with the occupational problem of burnout. So the second symptom is depersonalization. And that's a fancy term for you become cynical and detached. You start developing negative feelings about not only who you serve, but what you do. And you no longer feel connected to what you do or to the people that you serve. And the last hallmark is a lack of a sense of personal accomplishment. And that's when people begin to feel like what they're doing is no longer making any difference. And not only in the lives of the people they serve, but it's no longer making a difference in their life. They no longer feel that sense of fulfillment. And so those three hallmarks: emotional exhaustion, keyword exhaustion; depersonalization, keyword cynicism; and a lack of a sense of personal accomplishment, keyword inefficacy. People feel inefficacious. And I certainly hit all. I hit all three of these when I got burned out the first time and the second time. Now, men and women go through them a little differently. Women usually go through them in order. They get emotionally exhausted, they depersonalize, and then they end up feeling a lack of a sense of personal accomplishment. Men start usually with number two. They get cynical first.
Oh, interesting.
And then they will go back up and they become emotionally exhausted, but they almost never get to number three, which is a lack of a sense of or a lack of a sense of personal accomplishment. They always feel like what they're doing, they never feel like it has zero value. It always has some value, either to them or the people they serve. But what that means in real terms is when men reach one hallmark, they're 50% burned out. So those are the hallmarks. Those are the causes. And the problem that most people create is paying attention just to the hallmarks and not the underlying causes. And unless you address the underlying causes of burnout, you really haven't addressed burnout. And there's six major underlying causes. And just as I go through these, just think about any job you've had in the past where you might can identify with these. The first one is work overload. Feeling overloaded or overwhelmed by the amount of work you're being tasked to do. The second is lack of control, where you have no control over your day. You can't innovate, you can't create, you can't make your own decisions because you have to follow company policy or company guidelines or something along those of that nature. The next one is insufficient reward, where you feel like you're no longer rewarded, not just like monetarily, how much you're being paid, but you no longer get that sense of reward or satisfaction from doing what you're doing. The fourth one is breakdown of community, where you don't feel connected to anyone in your group or your organization or that business. The fifth one is absence of fairness, where you feel like if there's no openness, honesty, and trust in the environment you're working, then there's a sense of unfairness. Right. And it's very destructive to organizations. And then the last one is a lack of, rather conflicting values, where your core values, what you stand for, what you believe, there's a mismatch between those and the job you're being asked to do. In other words, in some way, your values are being assaulted by the tasks you're being asked to do. And so those 6 things are the underlying causes. And unless you directly address those causes, you can't get rid of burnout. You can make people feel better temporarily by treating the hallmarks. You can bring in yoga people and mindfulness people and time management people and exercise gurus, and all those things can help with the hallmarks or symptoms of burnout, but they never address the underlying causes, and therefore whatever relief people get is temporary.
That makes so much sense. And from the ones that you mentioned, I've definitely, I think, experienced all of them, but there are a few that I think affect me more severely than others. And is that kind of like common to have this variance around people as to what affects them more?
Absolutely. It's very individual. Now, it's not just the number. By the way, there's a survey tool. You can survey a work environment for those 6 underlying causes. It's called the Maslach Areas of Work-Life Survey, or the MAWS survey. And Christina Maslach developed that tool as well. So it's not just the number of those mismatches that are present. It's the degree to which they're being negatively impacted. Yes. In other words, you can impact all of them a little bit and nobody's burning out. You can impact one of them severely and everybody may be burning out, like conflicting values. If your organization is asking you to misrepresent the organization before clients, customers, or patients, if they're asking you to outright lie to them, that usually runs afoul of most people's sense of right and wrong and moral compass. And so people will leave that organization, by the busload. And that's kind of what happened to the VA system, the Veterans Administration healthcare system, kind of disintegrated because that they were caught lying to the patients about having appointments set up for them, or yes, we're going to get you that operation, or yes, we're going to get you that mental health provider. We have you on a list, and there was no list. They were padding their numbers just to satisfy the administrators. And so all the honest people left, that organization, and the ones that were left behind who didn't have any problem with what was going on stayed. And so you can imagine what kind of death spiral the VA system ended up in. And so it's not just the number of those underlying causes that are present, it's the degree to which they're being impacted. And it can be very individual. There are toxic work environments, and I will tell you that only 10% of people burn themselves out. They do this through workaholism, not taking care of themselves, developing an addiction. Their personal life is so toxic it's spilling into their work life. That's how people burn themselves out. But 90% of the time, it's the work environment. And that's
I'm so glad you're mentioning it, because this was my last question, because you said you're working with individuals, right? Yet all of this, right. A lot of these factors that you mentioned, they're not necessarily controlled by individuals. So then how do you address the underlying cause?
It's tough, and I'll tell you why. Because usually if you're talking about a toxic work environment, you're talking about a big group of, say, providers that are working in a big group, or you're talking about a hospital setting or a big mega conglomerate that has multiple hospitals. And whenever you start talking about changing the work environment, they start thinking, this is going to cost us money. We're going to, it's going to subtract from our bottom line. And they don't want to have anything to do with it. In fact, only about 5% of our country's hospital systems have advanced thinking along these lines. 95% do not, and are not doing anything to address provider burnout. That's why it's so high and still climbing. Yeah. So you have to go in with the message that it's really not a message. It's a series of questions. When you're talking to an administrator or a hospital system that has a high turnover and the employees are unhappy, the patients are unhappy, you ask them, how would you like to decrease patient complaints? How would you like to decrease employee complaints and absenteeism? What if I showed you a way to reduce your turnover and malpractice claims and medical errors? And not only would that save you money, it will make you money.
Mhm.
Is that something you might be interested in? And now you've got their attention.
Yeah.
Because there are enough studies to show that burnout mitigation not only saves companies money, it makes them money. One big way is to reduce turnover. If you've got a toxic work environment, you'll be churning through employees. In fact, that's one sign of a toxic work environment is high employee turnover. It costs to replace an internist, it costs about $250,000 to replace one doctor. If you're talking about a neurosurgeon, it can be $1 million. And so if you're turning over 10 physicians a year, you might be spending somewhere between $2.5 and $7 million. For a fraction of that amount, you can put some programs or policies or plans in place that will reduce that turnover and add that money back to a company's bottom line. And you get happier employees and patients. So it's worth doing. The problem is getting in the door, getting somebody's attention to listen to this message. For the individual employee, sometimes you can go to the employer and say, hey, I think things are not right around here. I think you know that. What can we do to change this? I think we're suffering from burnout. Why don't we get a burnout consultant to come in here and take a look at things and try to make change where you can at the level you currently find yourself. If that seems impossible or is impossible, you have a big decision to make.
Right.
Either you put your head down and grind away in a toxic work environment, doing a job you hate and detest. And the problem is you'll end up bitter, angry, and resentful,
Yes.
and it will shorten your life.
Totally.
Or you can take your natural talents and abilities, which are portable,
Yes.
and you can go someplace else that's a more favorable work environment that will honor your talents and abilities in a way that's personally satisfying to you at the same time helps others.
Yeah. Well, what you mentioned about the cost of turnover, I think that most organizations just don't see it that way, right? They don't see this intangible costs of burnout or toxic work environments and don't really understand that it really costs them money. So, how do you address that? What kind of data, I guess, or research do you share with your corporate clients to help them understand that this is the reality?
There are studies out there that have gone through pre-survey where they survey their workforce. They institute certain changes that address the underlying drivers of burnout.
Mm-hmm.
And then they go back and resurvey while at the same time they're watching their expenses and their bottom line. And study after study shows not only improvement in all of those things I mentioned earlier, but it saves costs in some arenas and it's income generating in others. In other words, they become more profitable because their turnover is less, they're being sued less often, there's less medical errors, there's less absenteeism, less patient and employee complaints. All those things add up to more productivity. And so advanced institutions like Kaiser Permanente in California, Stanford, Mayo Clinic, they have programs and policies and procedures that address those underlying drivers directly. And they've reduced their individual burnout scores. There's less turnover and all those other things improve. And so there's plenty of studies to show that this works. Again, it's an easy message to deliver. The problem is getting an audience. You have to keep chipping away. And what usually happens in some of the and particularly in my state, if you can get one big hospital system to adopt this, all the others will follow, because they don't want to be left out, of the latest and greatest whatever. And it's incumbent that administrators, there's almost an adversarial relationship between healthcare providers and administrators. And it's the same in the tech industry. There's almost an adversarial component to executives and the workers on the front line.
Mhm.
And one cannot survive without the other. Because the people doing the work on the front lines don't want to be administrators, and administrators don't want to do the work that the workers are doing. But you can't have one without the other, and so there needs to be more collaboration between administrators and workers.
And that makes so much sense, right? You're working together for the same goal. It makes a lot of sense.
Right.
Yet in practice, this is not the reality. So I wonder, as you go into these organizations, where do you face the biggest resistance to making this change? What are their biggest fears?
Well, again, it's usually it's going to cost us money.
Mm-hmm.
We're going to be less productive. It's going to upend the way we do things, and change is hard. In medicine, we talk about, there's this thing called clinical inertia.
Mm-hmm.
What that is when new data comes out that shows there's a better way to do this one thing that people have been doing a certain way, sometimes for decades. Mm-hmm. We need to stop doing it that way and do it this way, or use this particular treatment. And physicians are loath to change. They hate change. It's hard to move them off of what they're used to doing, that they know works and they know it inside and out, and move them over to a new way of doing it. Mm-hmm. There's a big headwind you face when that happens, and we call that clinical inertia. It's the same in business. There's administrative inertia, where it's like, we've always done it this way. It's working. Our employees, they're doing everything we ask them to do. Well, of course they do. You're paying them, and they know if they don't, they're going to lose their job. So they just keep giving them more to do, and here comes the work overload and the lack of control, and so it's a vicious cycle that they get into, and so it's overcoming that administrative inertia that's the difficult step. How to deal with burnout is not difficult. Yes. There's well thought out roadmaps to burnout and mitigation, elimination, alleviation, and prevention. It's just getting people to adopt it. That's the big.
Yes, and I can totally relate to it. One of the biggest topics in IO psychology is change implementation in organizations, and because we're humans, our resistance to change, just but the nature of having a brain and how it works, it's difficult.
For the individual, I would say this: if you are in an organization that will not change or can't change, or say they can't or won't, you have a decision to make. Everyone's skills are highly portable. You can take them wherever you go. But there is a burned out mindset. It's almost like addiction. There's people who think with addicted brains do crazy things. People who think with normal brains look at them and think, wow, that's crazy. Yeah. They can't understand the addict because they're thinking with a normal brain. The addict's thinking with an addicted brain. The addict is thinking, I can't understand normal people. Yeah. And so there's a burned out mindset that people get into, and they start thinking with a burned out brain. And the burned out brain tells them it's too late for me, change is too hard, I'm too old, I don't have the right skill set, I won't make as much money over there, and they keep placing all these barriers in front of themselves. Nobody's telling them that except the voice up in their head. And so they keep making excuses why it's better to stay in this comfortable misery they find themselves in, rather than making difficult choices, which they've made all their lives. We've all made difficult choices, and it got us to where we are. So we can always change and go off in a different direction. So it's just overcoming that mindset that none of that is true, that there is a place for you out there that's more conducive to your own set of values and moral compass, and lets you use your unique and set of talents and abilities in a way that's personally satisfying to you and helps others. That's the name of the game.
Yeah, I hear you. I can totally relate to it. And I've heard that before, that um, not necessarily in relation to addiction, but yes, that people will stay in an uncomfortable environment just because it feels safe, and it feels safe because it's familiar.
Familiar.
Yes.
Yeah, and that's the inertia that you have to overcome and realize that change is good. Sometimes it's good to change things up. It makes you stretch and grow in ways that you were not anticipating.
Yes.
And picking up new skills, adopt an attitude of lifetime learning. I'm going to learn new skills and new ways of doing things for the rest of my life, because it will all come in useful at some point.
So did you ever yourself experience that inertia? And if you did, how did you adopt the attitude of learning?
Well, I did. It was difficult to admit to myself that, well, I didn't know what was wrong at the time when I was burned out. I just knew something had to change. And so it was difficult to go to 3 days a week, and in some ways uh, abandon my responsibilities at the office. That's what it felt like. It felt like I was abandoning my patients. But there's one key message I wanted to put forth, and especially when you talk about wellness. If you don't take care of yourself, how are you going to be the best doctor, the best lawyer, the best IT person, the best plumber, electrician, whatever, the best writer or singer or poet? If you don't take care of yourself, all the other arenas in your life are going to suffer.
Yeah.
And so excellent care, for me, excellent care of patients became taking excellent care of myself. I had to take care of myself first. And if you ask people what's most important in your life, they'll start listing, God, family, friends, and they're usually somewhere down on the list down there. And so what that means is they're taking care of everyone else's needs before they address their own. Now, most everybody's been on an airplane, probably not in the last 1 year, but most everybody's been on a plane. And when they go through the safety precautions, they say if the masks drop and you have a child, what do they tell you to do? You put your own mask on first, and then you attend to the child, because you're no good to the child if you can't breathe, right? It's the same with work and family and community. I submit we've got this model all wrong, that people need to put themselves up at the top of their list of items to care for. Now, that may sound selfish, but it's not. It's self-interest. That's different than selfishness. Selfishness is, I want what you have, but I don't want to do anything for it, so give it to me. That's being selfish.
Yeah.
Self-interest is, I want to be the best I can be at what I do. And that means I have to take care of myself. And when I'm at my peak, I will be at my peak performance, and I will be able to benefit not only myself, but others. That's self-interest, and there's a big difference. And so I think we should put ourselves up there and make sure we get adequate rest, adequate exercise, that we eat healthy, that we let go of toxic relationships, that we seek freedom from debt and shame and guilt, and all the things that hold us back. And certainly if you have an addiction or if you're burned out, you can never lead a life of happiness and passion-driven purpose if you're burned out or addicted. So you have to take care of those arenas as well. And all those things together make a person well.
Yeah, thank you for mentioning it, because I think this is so important. I notice and hear people not wanting to take care of themselves as if that is something bad,
Right.
and I'm glad you made this differentiation between selfishness and what you called self-interest.
Mhm.
That selfish, right? Yes, I want to get something and I'm going to do it at like your expense, but self-care is completely different. And
Mhm.
the truth is that I can't contribute in the best possible manner to my organization or to my family or to my community, to whatever, if I'm not taking care of myself. It's just a fact.
That's a fact. I mean, look at athletes. They do everything they can possibly do in almost every aspect of their life to shave a couple hundredths of a second off their time. They have to take care of themselves. They're taking care of themselves to the nth degree. And that's why they're able to do such amazing things. And so it, it is counterintuitive that people who uh, it's like you said, they feel bad about taking time to take care of themselves, and they feel it's noble to exhaust themselves taking care of others. And there's
Right.
nothing noble about that. It's crazy, and it doesn't make any sense, because you're no good to anybody if you don't have enough rest, if you're irritable because you've been working so much and you've not taken the time to rejuvenate and get some rest and relaxation, and if you're sleep deprived, overworked, um, and you're running around taking care of everybody else's needs before taking care of yourself. There's a word for that. It's called codependency.
Mm.
You're being codependent. So I think we need to, self-care is paramount if you want to be the best person you can be and the best producer at whatever you're into. If you want to be the best at your craft, or if you want your skills to be the best, it begins with excellent care of self. You have to take care of yourself. And it's also an exercise in self-awareness. It's knowing when you need to stop, when you need to say no to endless requests. People will bomb you with endless requests for help, and we want to be helpful. We want to be thought highly of, and so we just say yes, but we don't stop to consider when we say yes to one thing, we're saying no to something else. When we say yes, I'll do that thing for you, you're saying no to something else, because you're giving up that time slot to that thing. And we all get 168 hours a week, and no more, no less. And so you have to be careful with your time and make sure some of that time is carved out for self-care.
Okay, so I understand on an individual level, this is how you need to carve out time for self-care and define for yourself what does it look like for you. So how would or how do you help organizations on the like group level create an environment where taking care for employees, taking care of themselves is rewarded and not
Right.
punished?
So it's just like people are different, organizations are different.
Mhm.
Even different hospitals in the same system are different. There are different local factors that are specific to individual groups than in this city versus that city over there. So uh, organizations are all different, people are all different. So when we do a consult, and I'll talk about this in the book, there's a chapter devoted to what organizations can do. And it begins with a survey. You have to survey your workforce, because a lot of times people just guess what's going on and they have no idea what's going on under the surface until you survey for it. So you do a mass like burnout inventory to measure the degree of burnout in your workforce and per individual. You do a debriefing for that. You look at that data, and then you go in and you do a mass like areas of work life survey, which measures the negative impact on those 6 underlying causes: work overload, lack of control, insufficient reward, breakdown of community, absence of fairness, and conflicting values. So now you know exactly what arenas where the problems are. And then you do a debriefing for that. Sometimes we also apply the DISC personality profile, which is a communication style survey, how people communicate with one another, because a lot of problems are generated by communication mismatches, one personality type versus another. And so we look at all of that, and then we begin to see where we can have the biggest impact. We pick the 2 or 3 underlying drivers that are the highest negative score. And we say, okay, what can we do to improve this area called conflicting values, or this area called work overload, or insufficient reward? What can we do to move that needle in the opposite direction and make it more positive? And you never know going in what the solutions are going to be, because you have to get all the stakeholders in a room and begin discussing this, because the solutions are all sitting in the room. You just have to give people time to think and voice their opinions, and the best solutions will bubble up to the surface in those work groups. Then you implement some change. Doesn't have to be monumental. Sometimes it can be just small little changes, can make a big, huge difference. Reducing the Maslach burnout inventory scale on depersonalization, decreasing that by 1 point in a medical setting reduces your medical error rate by 11%.
Wow.
Just reducing that score 1 point reduces your medical error rate by 11%. So small changes can have a big impact. So you implement those changes, you let some period of time go by, usually about a year, then you go back and you resurvey and find out if you move the needle. And then you readjust, you make more change, more policies, more plans, more procedures. You look over here and see what that institution's doing that worked. You might adopt some of that. And this should be a yearly cycle, just like going to the doctor and getting a checkup. In fact, the National Academy of Medicine said that all organizations should do this every year as a part of policy, because it tells you where the problems lie and gives you a way out.
Yes, thank you. So I want to talk about your book a little bit. So can you tell me what it is about?
Well, it's largely about everything we just talked about. It starts out with my story of how I got burned out and how I came to be interested in this topic. And I've spent a lot of time and energy on it because it's such a big problem in medicine. Now, there is a detectable burnout rate in any profession. It's just that some are higher than others. Medicine, law enforcement, firefighters, teachers, lawyers, financial analysts, they all have, social workers, they all have screaming high burnout rates. And so it talks about that. It talks about the hallmarks and it describes those in detail. It talks about the underlying drivers, those 6 mismatches between the employee and the job they're being asked to do, and describes those in detail. And then it talks about what to do about it and whether or not you burned yourself out or you're suffering from a toxic work environment. The center section of the book is actually almost a workbook. It asks you to answer certain questions, fill in some blanks, circle some answers, make some lists, and it's all designed to shepherd you toward asking yourself and answering some of the big questions so that you can make some change.
Okay, so it sounds to me like it's a tool. It's a tool. Yes, I can use for myself to understand my own burnout and what I can do about it, but also for organizations to use in the professional setting if they wanted to. Yeah. Okay.
Yes.
Well, that's exciting. I'm still waiting for my copy. I still didn't get it.
You haven't gotten it yet?
No, I guess maybe because of the snowstorm, I just haven't
Maybe,
it yet.
maybe so. I'll check with my office, make sure it got mailed.
Okay. Well, which is okay, but I'm looking forward to.
Well, you will get one. I'll promise you, you will get one.
So a couple more questions. One, if I came to you and I was your client and I was burned out, what 2 3 strategies or tools would you recommend to me to use to start recovering?
Well, first you have to understand what the problem is. And so I think just educating yourself on burnout and how it's different from stress. A lot of times folks equate people who are overly stressed with burnout, and the two are completely different. Now, if you're burned out, I promise you, especially if you're severely burned out, I promise you, you're stressed 100% of the time. But you can be stressed without being burned out.
Mhm.
And with burnout, the damage is primarily physical. With stress, the damage is primarily physical. With burnout, it's primarily emotional. People get that emotional exhaustion and they detach. And so the rates of depression and suicide are higher in people who are burned out versus people who are just overly stressed. So knowing which of those two you are is a good first step. Also, did you burn yourself out, or are you in a toxic work environment? That's another important question to answer. Again, that center section of the book kind of helps you, tease that out, figure that out. But I would tell folks just to start reading. There's a lot online that's free and available about, I get papers every week. I have Google keywords and alerts set up. I get 2 or 3 articles a week on professional job-related burnout and what's being done about it. So there's a wealth of information already out there. Christina Maslach wrote a book called The Truth About Burnout. That's an excellent reader it's not very technical, it's not very long, it's understandable, talks about a lot of the things I talk about in my book. That's an excellent resource. And then the National Academy of Medicine, you don't have to be a doctor to go there. You can go to their website, the NAM website, National Academy of Medicine.gov, I believe. They have what's called a knowledge hub. If you scroll down on the first page, you'll see knowledge hub. You click on that. There are tons and tons of information there on burnout and what to do about it. So just start reading and understanding, gain more understanding about where you are.
Yeah, thank you. So, my last question is about COVID, burnout, and our healthcare workers. And, you said earlier that only about 5% of either hospitals or some kind of medical organizations are really agile, I guess, and are considering factors like burnout in their work environments. So given that 90 to 95% don't, and we had this year of 2020 and still going in 2021 where healthcare workers have been extremely stressed. And so what are we going to do?
Yeah, we're seeing the effects of that now. We're getting more referrals for disruptive type behavior where physicians are just acting out because they feel so bad. We had more relapses, people that were under monitoring agreements for a chemical dependence. We had 23 people relapse last year, which was like triple prior years. Our success rate at 5 years of sobriety is like somewhere between 85 and 88%, which is excellent. But this last year, 2020, we saw a big, huge increase in relapses. And basically, as people who feel so bad, they're trying to make themselves feel better in some way. Yeah. Suicides ticked up, depression rates ticked up, everything got worse. Because if you look at what COVID did to the healthcare system and look at what it did to small businesses outside healthcare, and look at those underlying drivers, look how many of them have been negatively impacted by the COVID situation. Work overload. A lot of healthcare providers, it went one of two ways. Either you were so overwhelmed, you had to, spend most of your time at the hospital or in the clinic. But there were other places where doctors didn't have anything to do and actually got furloughed. So the insufficient reward, their pay stopped. or their income dropped because all the surgeons, they canceled all elective surgeries, which are 90% of the operations that are done in America are elective. Knee replacement, hip replacement, gallbladder. You may need your gallbladder out, but it's not a medical emergency in most instances, and so it can wait. And so all those things got canceled, and people's incomes plummeted. Well, their bills didn't go away, and so financial insufficient reward got affected. Conflicting values. Imagine a nurse taking care of a unit patient who's dying, and their family can't be in the room. You're the only go-between, and it's not right. It's not fair. Absence of fairness. So if you look at all the underlying drivers of burnout, they all got amplified by the COVID situation. And so when people burn out, they will sometimes act out with drugs, alcohol, bad behaviors, depression, and suicide. So it's been tough, and we have not. I don't think it's peaked yet. There may be a wave coming this next year.
Wow. So, what would you say is the way out? Like, what do medical organizations now need to do to help alleviate this?
Well, they need to take a step back and see how they're utilizing their staff. Are they overworking them? One thing. Do they have some measure of control? Can they innovate and create on the fly? Or do they have to follow some script? Because that's a lack of control. Do they have some measure of control over their day? Are they being sufficiently rewarded? Is there anything they can do to alleviate the sense of absence of fairness? Is there openness, honesty, and trust in the organization? Or are people fearful and distrustful? So all those things need to be looked at. Grief counseling, certainly mental health services in general should be provided confidentially and for free to any healthcare worker who feels like they're suffering mentally and emotionally. They should be given the help that they need, hands-off approach. You go take care of you. So it all begins with, again, we're back to self-care and taking care of because that's the only person you can really assure that you can take care of is yourself.
Yeah. Thank you for sharing that. Yeah, and it sounds like to me that on the organizational level, people need to take a step back, take a breath, and be like, okay, yes, we're dealing with the problem, but let's look at our people. How are our people doing? Because if they don't do that, ultimately, eventually, it's going to lead to a lot of negative results for the organization. Okay, well, thank you so much, Dr. Gaither. If people wanted to find you, how could they do that?
Yeah, it's easy. It's clarkgaither.com. That's my name.com. I've got a website there. And there's some free tools there too, by the way. Folks can put in their email address and name. And by the way, I won't bombard you with a bunch of emails if you do. But if you put your name and email address in there, you can unlock some downloadable free tools. One of them is a core values inventory, which everybody should complete at some point in their lifetime. Know what your top 5 core values are and your number 1 core value. And always seek to honor those in whatever you do and any decision you make. And those will be better decisions for you, I promise you. And avoid dishonoring them, because if you do, whatever decision you make that dishonors your core values is going to be a mess. Every time in my life I've got kind of gone off the rails, it's because I was dishonoring one of my core values. So if you've never done a core values inventory, there's one there. I would spend about 3 days or a weekend filling it out. If you don't know what all the core values are, there's over 400 of them listed in the appendix. So it's a useful tool for the individual. There's also some checklists for individual burnout, corporate burnout, those kinds of things.
Okay. And your book, is it available on your website?
It's available. I talk about it there, and you can purchase it there, but quite frankly, you can get a better price on the online booksellers, Amazon, Barnes and Nobles.
Okay.
Anywhere books are sold, you can get it either retail or online.
Okay. Wonderful. Thank you. Well, I'm looking forward to getting mine.
Well, I'm gonna call my office first thing Monday morning and find out if that got shipped. It was supposed to be shipped, but I will make sure.
I appreciate it. Yes. Yes. Thank you. Thank you for a wonderful conversation. And thank you, friends, for listening. I will see you back here tomorrow.